Hi, this is my second video in the Homeless Services series. In this video, I'm addressing homeless outreach. Coordinated street outreach that identifies and engages people living in unsheltered locations such as cars, parks, abandoned buildings, encampments, and on the streets plays critical roles within systems for ending homelessness. Effective street outreach reaches people who might not otherwise seek assistance or come to the attention of the homelessness service system, and it ensures that people's basic needs are met while supporting them along pathways towards their housing stability. Most street outreach in communities is currently funded through a patchwork of government programs and private resources with varying mandates, requirements, and performance measures. It is also not funded at levels that would allow for the implementation of the full range of activities and approaches described here in most communities. Communities should, however, be striving to strengthen the roles their street outreach programs play within effective systems for helping people who are living unsheltered return to stable communities living in safe and affordable housing. Before I begin discussing ways to provide effective street outreach, I want to discuss counterproductive measures that are common in many of the communities we serve. These programs are not intended to be malicious, but have the result of a greater negative impact on the homeless population. The first group I'll title Lone Wolves versus the Pack. There are numerous individuals and church groups that set up their own response to people who are homeless. The primary intent of these programs is to make the individual helper or church group feel good about what they're doing in the community. But this is a band-aid approach resulting in food assistance, clothing assistance, or financial assistance that does very little to change the homeless person's situation or environment. It is better for the individual helpers and church groups to actually coordinate with the larger system of agencies that work together to meet the basic needs of these families. The second negative impact I will mention is exploiting the homeless. There are individuals in the community who exploit the homeless for increased personal attention upon themselves, whether it's someone who chooses to live temporarily as a homeless person or is someone who thrives on media attention when interviewing the homeless. Their work does little to change the homeless person's situation or environment. In fact, the increased media attention can create greater negative results for these families. The third area that I would be concerned about is agency versus client focus. This third counterproductive measure occurs when agencies serve the homeless for the benefit of the agency over the needs of the client. A prime example is the transitional housing facility that fills their beds with homeless individuals so that they can continue to receive funding and do little to change the homeless person's status as homeless. The primary intent is to be politically visible in the community so that they can get those high dollar givers to give to their organization. Many veteran homeless programs fall into this category. Their goal should always be permanent housing for the client and not filling beds for the agency. This video is intended to identify core elements of effective street outreach that can be implemented under various funding streams and which are broadly applicable to a variety of communities, geographic contexts, and subpopulations. It's important to acknowledge that the implementation of such efficient systems requires access to housing affordable to people who are exiting homelessness. Strategies to expand the supply of such housing can be implemented at all levels of government and across the public and private sectors, including removing local policy barriers that limit housing development in the private market, prioritizing people experiencing homelessness for available housing resources, and expanding affordable housing opportunities through actions across all levels of government. In Brevard County, we developed a process that included an entry point. In our case, it was 211. Then they were handed off to outreach services. Those outreach services completed the assessment process, and those individuals who were deemed the most vulnerable were placed at the top of the list, and a coordinated housing assessment team would work with that case, usually working with priority vouchers within the housing authority system to place the most vulnerable into those housing authority units, along with housing case management. In retrospect, now that I go back and look at this situation, I would have started initially by setting up the case management services at the beginning of the process instead of after they are housed. They should start receiving case management at intake. The core elements of effective street outreach, it's our hope that communities will use this list of core elements of effective street outreach to assess their current outreach efforts at both the program and system level and identify opportunities to build upon and strengthen those efforts within the systemic approaches for ending homelessness, particularly those who are unsheltered. Street outreach is conducted on behalf of the community rather than one agency, requiring collaboration among multiple stakeholders. Knowledge of and engagement with all partners implementing street outreach efforts leads to a more strategic use of resources and more comprehensive coverage and identification of all people experiencing unsheltered homelessness. When there's multiple agencies out there doing their own thing and are not coordinating together, how is that helping the homeless individual? They need to work together for the sake of the client, not for the sake of their own individual interests as agencies. Street outreach is coordinated among various providers engaged in ending homelessness and across different entities such as federal, state, local government, and nonprofits. These entities may utilize multiple funding sources to conduct street outreach. Some of the effective ways to provide street outreach are, from my own examples, the December 21st Homeless Memorial Service. Each year we would have a memorial service at one of the, or more than one of the agencies, to memorialize those homeless individuals who are identified as having passed away during the year, December 21st being the shortest day of the year. The second process would be the point in time count, and I'll have another video completely focused on the point in time count process and how that can be organized. It's usually done at the end of January, and it is a count of all the homeless in the community that helps determine the funding to address homelessness in that community. A third way is search and rescue efforts by outreach organizations identifying homeless individuals with disabilities. These could also include what they call SOAR caseworkers who help them obtain their Social Security benefits. Another one would be community feeding programs that are already in place in your community could serve as outreach opportunities to encourage homeless individuals to participate in these services. And then finally, there's shelter in place. There are some situations where an individual may choose to remain homeless or there's no housing opportunity available to them. In those cases, they would provide shelter in place with the agency providing needed services and occasional well checks. Street outreach efforts are also coordinated with a broader network of programs, services, or staff who are likely to encounter individuals experiencing unsheltered homelessness, but whose regular focus is broader than homelessness. This might include law enforcement and other first responders, hospitals, health and behavioral health care providers, child welfare agencies, homeless education liaisons, workforce systems, faith-based organizations, and other community-based providers. And here's some other ways to involve those organizations in your process. One is to coordinate with your local emergency management office and law enforcement when planning and implementing your point in time count. But do your research. Don't involve services that are going to use that point in time count to identify camps to bulldoze them. You need to make sure you have your training and safety situations in place ahead of time. Second of all, identify a transitional housing program that will use one of their units as a step-down shelter for homeless individuals exiting hospital services. And another way would be to coordinate with health and behavioral health care providers to receive referrals from the housing case managers, assist homeless individuals in obtaining health insurance or enrolling in a federally qualified health care facility. Street outreach efforts are connected to coordinated entry processes. People sleeping in unsheltered locations are assessed and prioritized for assistance in the same manner, as any other person assessed through the coordinated entry process. All street outreach contacts and housing placements are documented in the Homeless Management Information System, otherwise called HMIS, or another local data system such as an active or by name list. Outreach workers have access to data systems to be able to input data, look up previous contacts with the person experiencing homelessness, and access information on available resources. The data is important to measure community success in addressing homelessness, but also to obtain additional funding. Where street outreach providers or coordinated entry processes have established data sharing agreements and protocols, outreach providers can access data that helps them more effectively focus on supporting housing outcomes. Data on frequent use of shelter, emergency health services, and jails, when reviewed alongside HMIS or by name list data, can lead to a more comprehensive identification of high need individuals. Now, the intent here is to, again, identify the most vulnerable so that we can serve them first. The goal of street outreach is to make connections to stable housing with tailored services and supports of their choice, such as health and behavioral health care, transportation, access to benefits, and more. Street outreach does not require individuals to enter emergency shelter or transitional housing as an interim step or prerequisite to accessing stable housing. However, street outreach does make immediate connections to emergency shelter or temporary housing to provide safe options while individuals and families are on a pathway towards stability. There are some instances where transitional shelters are actually preferred, and some of those examples are domestic violence shelters, where domestic violence survivors can be in a safe environment as they reestablish themselves and their lives. Children in transition facilities, facilities for runaway kids or kids who are removed from domestic situations. Those temporary shelters are important to have. Victims of human trafficking, individuals with medical needs, prison reentry programs. All of these are instances where transitional shelters are preferred over permanent housing. To the extent possible, street outreach utilizes housing first approaches that do not impose preconditions to make referrals to a permanent housing shelter or other temporary housing, such as sobriety, minimum income requirements, absence of a criminal record, completion of treatment, participation in services, or other unnecessary conditions. Some housing options in the homeless system may not be available due to specific eligibility criteria, such as being listed maybe as a sexual predator. In the past, many of the transitional housing services that were made available from the 80s on up to the aughts were programs that really just simply cherry-picked those people who they knew would be successful in their programs, and therefore they put all these qualifications in place to keep the people they didn't want in their programs to participate. All that has been turned on its head because now we focus on identifying the most vulnerable and serving them first, and then going down the list from there. Street outreach efforts are person-centered, trauma-informed, and culturally responsive. Street outreach utilizes a person-centered approach, focused on the individual strengths and resources, and never makes assumptions about what a person might need or want. And that's why I said case management should begin at intake. It's the client who should determine what it is that they need and want for themselves. It's not the agency or the social worker who should be telling them what they need. Street outreach workers provide people experiencing homelessness with multiple opportunities to say no and make repeated offers of assistance as necessary throughout the engagement process. If they are sheltered in place and if they're in their homeless camp and they just don't want to move or not ready to move, it may be they're just not ready to move at that time. So what I'm saying here is be persistent, just not forceful. Make yourself available. Let them know you care. Let them know you're checking on them, and then continue to offer them the opportunity, if it's available, to move into housing. Third, street outreach staff receive regular training in evidence-based practices, including trauma-informed care, and are proficient in utilizing such practices. There are many untrained volunteers and church members within programs who can actually do more harm than good because they're not trained in responding to the needs of many of these individuals. Street outreach providers employ outreach staff with lived experience and offer commensurate compensation to all outreach staff. In many cases, those people who have endured that situation and have come out of that or recovered many times can be very helpful to the person that is still in that situation. Street outreach workers provide warm handoffs to coordinated entry or to shelter housing and service providers. Outreach staff may offer to actually physically accompany the individual to appointments to provide support. And in our case, we set up a coordinated housing assessment team. So the case manager would bring the information and many times the client to that team to help identify what the best options were for housing for that individual. Street outreach efforts are respectful and responsive to the beliefs and practices, sexual orientations, disability statuses, age, gender identities, cultural preferences, and linguistic needs of all of the individuals. Street outreach efforts analyze local data regarding racial inequalities and disparities among people experiencing homelessness and tailor and customize their efforts to ensure that equity is being achieved within their outreach activities and outcomes. This might include diversifying your staff and leadership, assuring appropriate geographic coverage, training all staff in issues of equity and cultural competency, and regularly analyzing performance and outcomes with a focus on racial equity. Street outreach workers utilize problem-solving techniques to identify strengths and existing support networks, explore possible safe housing options outside the homeless service system, such as maybe reunification with family, and connect the individual to community support and services. Again, like I said before, case management is key, and I would say begin that case management process at the beginning of the process rather than after they are housed. Street efforts emphasize safety and reduce harm. Street outreach providers have protocols in place to ensure the safety of all individuals seeking assistance. These protocols help ensure that people fleeing domestic violence, as well as dating violence, sexual assault, trafficking, or stalking, have safe and confidential access to the coordinated entry process and domestic violence services. Street outreach efforts utilize harm reduction principles, including non-judgmental, non-coercive provision of services and resources. Street outreach efforts accept that some individuals may not initially accept offers of emergency shelter or housing assistance. While maintaining a focus on creating connections to permanent housing, outreach workers establish rapport and reduce harm by providing critical life-saving resources such as food, water, clothing, blankets, and other necessities, otherwise called shelter in place. Coordinated and persistent outreach, in-reach, and engagement efforts allow communities to bring services directly to people experiencing homelessness who otherwise may not seek out services, and to connect them to permanent housing and necessary support. Many individuals experiencing homelessness are disengaged from and may be distrustful of public systems and may be reluctant to seek assistance. Assisting individuals to overcome these barriers often requires significant outreach time and effort and can take months, or even in some cases years, of creative and proactive engagement. So, in summary, these are the practices that work. Number one, housing first. Connecting people with permanent housing as quickly as possible provides a platform for addressing health issues, pursuing employment, and attending to other needs, thereby reducing the likelihood of becoming homeless again. With evidence of the effectiveness of the Housing First response and increased availability of supporting housing at the local level, community outreach efforts can offer more than meeting only the basic needs of individuals experiencing homelessness. They can offer connections to meaningful pathways to housing stability. Number two, a systematic documented approach. Regular and consistent documentation of outreach efforts decreases the likelihood of overlooking individuals experiencing homelessness who are most in need, as well as the duplication of services. A systemic approach also allows greater participation from other partners and systems in the community and faster access to a wider variety of targeted and mainstream programs. So this is where you involve the entire continuum of care, including those church programs that already exist in your community, and have them part of the overall systematic documented approach. Third is collaboration with non-traditional partners. Homelessness service providers are teaming up with a variety of non-traditional partners such as law enforcement, jails, prisons, hospitals, and other healthcare providers to identify and target individuals who may be experiencing or at risk of homelessness and to connect them with housing and services. Salt Lake City, for example, is piloting a program in which social workers accompany police officers as they canvass the city streets. Another example is providers who partner and build relationships with insurance enrollment and outreach efforts associated with the Affordable Care Act. Number 4, high quality data. The Homeless Management Information System, or whatever data system you may be using, such as an active list, include client-centered data on all people experiencing homelessness within the community, and is informed by various data sources. All outreach contacts should be recorded, and permanent housing offers tracked and monitored on an ongoing basis. Having high quality and complete data at the person level allows communities to better monitor their progress and hold themselves accountable to identifying and quickly helping every individual experiencing homelessness. And like I said before, that data also helps in terms of obtaining additional funding. Number 5, coordinated entry. As communities begin to implement or strengthen coordinated entry processes, they create opportunities for providers who may not have communicated as regularly in the past to collaborate in ways and simultaneously promote the standardization of housing assessment and referrals, improve targeting, and more quickly connect people to appropriate and tailored housing and services. This process also encourages communities collectively to prioritize housing for individuals who have the highest need. Targeting. Assessment has improved greatly over the last several years, allowing outreach workers to more quickly identify people experiencing homelessness and connect them with the housing and services that are most appropriate. Often, the population with the highest needs are frequent users of shelter, emergency health services, and the criminal justice system. Targeting individuals based on vulnerability and high utilization increases the possibility of comprehensive outreach by diversifying the points at which individuals are identified. Data sharing. When data sharing across the system occurs, individuals with the highest needs can be identified more easily from multiple systems and programs. Formal agreements and memoranda of understanding exist to address privacy and confidentiality issues associated with sharing other sources such as hospital and jail data. Hotspotting. Incorporating data on utilization of services, or hotspotting, is a process for identifying concentrations of high-need individuals geographically. Periodic mobilization of intensive, comprehensive outreach across a community's full geography can identify and confirm locations of hotspots. And then institutional inreach. The needs and experiences of individuals experiencing or at risk of homelessness make corrections, healthcare, and behavioral health systems all prime candidates for institutional inreach. For example, in Los Angeles, a collaborative was formed to provide pre- and post-incarceration services to meet the needs of chronically homeless individuals who have repeatedly been involved with the criminal justice system to ensure that they have support as they seek employment and family unification upon entry. We did also the same thing in Brevard County. One of our community agencies developed a reentry program and a facility to help those individuals who are coming out of jail to transition back into a stable housing environment. Warm handoffs. Outreach workers often forge deep ties with individuals experiencing homelessness. Effective outreach ensures that there's a gradual warm handoff for housing and service providers. Street outreach workers should also visit people in their housing for the first few weeks after moving in to reinforce the transition and to provide support to the individual and their providers. Training in evidence-based practices, trauma-informed care, motivational interviewing, and critical time intervention are among the many evidence-based practices useful to those working with individuals experiencing homelessness. Where time and resources permit, formal training for homelessness service providers and other community members will increase the effectiveness of the community's outreach, inreach, and engagement efforts. And diversity of approach. The continuity of traditional outreach on the street, in campsites, at drop-in centers, and in soup kitchens is important, but outreach and engagement efforts must be diverse and robust. For example, using social media can be particularly effective in reaching youths experiencing homelessness. Final statements to make. First of all, identify essential components of outreach and engagement. The list of components contributing to successful outreach and engagement should be refined, studied, and shared with communities. Curricula should be adopted or developed to teach staff essential skills such as open communication, ethics, cultural competency, mental health first aid, staff care, strength-based and person-centered approaches, recognizing patterns of indirection, and accessing coordinated entry. Supplemental training on preferred or best practices in case management and on using data is also recommended. Much information out there that can be shared. Creatively resolve funding issues. Outreach and engagement activities can be the most engaging and most challenging to fund, in part due to an unclear understanding among funders of what outreach services entail. The role of outreach in preventing and ending homelessness should be better promoted, and additional guidance should be created regarding federal resources that can be used to fund those activities. Ensure that other local Housing First responses are inclusive of access in healthcare and recovery supports. Housing First must not be interpreted as housing only or housing as first in a fixed sequence of service provision. Providers and policymakers should continue to promote this concept and ensure that messaging emphasizes that the path leading to permanent housing should include connections to health and behavioral health services and support based on the needs and preferences of the individual. It's not just it is housing first that is important to them, but it's not just housing first. It's all these other services that need to be provided in order to maintain their housing stability. And finally, clarify data sharing parameters. Navigating the data sharing process can be difficult for some communities. Providers and staff at the local and national levels should develop and share basic practices and how to based on community experiences. Workaround solutions need to be established for those highly confidential situations. Thank you.